are over 200 genes in the human body out of 20,000 that are often associated with Crohn's disease, which in retrospect doesn't really seem like that many, but whenever talking about it affecting millions of people, it is actually quite a lot. Crohn's disease is often treatable by medication and is often able to be put in remission. To be in remission means you are able to virtually have no symptoms, which is what the target is for most Crohn's disease patients because there is no cure. In an article from the Mayo Clinic about Crohn's disease by William Fabian, he talks about the many different symptoms that you have with Crohn's disease. Symptoms often include things like abdominal pain, diarrhea, bloody stools, fever, fatigue, which is an overall sense of feeling tired, and unintentional weight loss and malnutrition. Some less common symptoms often include kidney stones and iron deficiency. You may have all of these symptoms or you may have none at all, which makes Crohn's disease often really hard to diagnose. Crohn's disease can take place in both the small and large intestine. And in this picture right here, it shows how it can occur in many different places of the bowel, where it shows the small intestine and the large intestine, or it can continue into a continuous loop where it's at the end of the small intestine and goes all the way down to the anus. That often makes it really hard whenever people have to have surgery because it often involves a large portion of their bowel having to be taken out. This can lead to complications. Complications may include fissures and fistulas, which are connections that are not supposed to be there in the bowel, and an obstruction. An obstruction is where a portion of your bowel gets blocked off from another portion and you are virtually unable to go to the restroom. In another article called Enteral Nutrition in Crohn's Disease Pediatric Patients by Tita Tartemis, he talks about the many different types of treatment. Enteral nutrition is where a tube is placed in your nose that feeds all the way down into your stomach, and patients usually have them for about 6 to 8 weeks. This is a liquid form of nutrition that feeds through the tube, and it's their only source of nutrition that they have, so they don't intake any other food. This is what makes it best for them to be able to gain weight while they are still dealing with Crohn's disease symptoms because it is virtually very hard to eat. Another type of treatment is called corticosteroids. 2 different types of steroids are called prednisone and budesonide. These reduce inflammation in the bowel. There are also other different medications called biologics. These include Humira, Stelara, and Skyrizi. They target proteins that are in the immune system that help with Crohn's disease. And in many extreme cases, surgery is necessary in Crohn's disease. Things like biologics and surgery often can be very expensive for patients, so it is not the first line of treatment that people usually go for. In another article called Crohn's Disease by Robert Dolinger, the diagnosis of Crohn's disease often involves many different steps. There are things that you can do with stool studies which show the many different types of inflammation that you can have on your body. You're able to do a C-reactive protein in your blood to be able to tell if you have inflammation. And there's a different stool study called a calprotectin, which shows how much inflammation is in your stool. There are different endoscopic measures that you are able to reach, like an endoscope and a colonoscopy. These are able to take pictures in your colon through a scope, and they are also able to collect tissue samples that will tell you if there is any Crohn's disease present in the mouth. And then there is imaging such as CT scans and MRIs, where they are able to visualize your abdomen without an invasive approach, because often with all of the inflammation, they are unable to get a scope. Since Crohn's disease affects millions of people and it is treated by medication, Crohn's disease patients often look for remission as their number one target. And since it affects so many people, we are often looking forward to finding a cure towards Crohn's disease in the future. Thank you.